Hello everyone, David Wilson here, doctor from Dr. Stemcells, and in today's video we're going to look at a paper. I'll just pull it up now. The role of cells and gene therapies in the treatment of infertility, patients with thyroid autoimmunity. The interesting thing about this paper is that as I read through the paper and prepared for my talk today, I discovered that a lot of the mechanisms of action for these stem cells to help with thyroid-induced problems are probably going to be relevant to patients with infertility in general. Now, this paper does not say that, and I am not saying that this is medical advice. Anyone with infertility should run out and try and get a stem cell treatment, by no means. However, what I am suggesting is that this is absolutely an interesting idea for the future of stem cell research, and I think this is something I'll have to look into and see what other research exists in this space for another video. As you can see, they talk here in the abstract about the rising incidence of infertility. It is a large and increasing problem across the world. We unfortunately see that there are many people affected by it as the aging population increases. That not only means that we have people who are older when they maybe stop work, they're older when they die, they're older when they get sick, but we also find that a lot of people are getting older when they get pregnant. And there are a lot of very planned pregnancies happening, or people who have decided to try to become pregnant, and maybe they're in their mid to late 30s. And these are age groups of women where previously we might have been a little bit harsh and called them geriatric mothers. But this is not something that we really talk about so much anymore, because it's becoming more and more normal for ladies in their mid 30s to late 30s to want to become pregnant and to have children. One of the interesting results of this increasing in age is that we find a correlation not only to the age of the mother trying to get pregnant, but there's also an increase then in the correlation between the fertility window and all of the other diseases that we know can happen to ladies and gentlemen, of course, but in this case it's the female reproductive system, as it can happen to women as they age. One of the most common diseases for women in their fertile age group, that is to say probably between, let's say, 18 and 40, is hypothyroidism, or thyroid autoimmune disorder. It's expected that this disorder affects somewhere between 5 and 15% of women in this age group. And as a result of that, this means that these women may struggle with fertility problems. And one of the driving factors of this video is that for many of these women, they may not even know they have low thyroid, because you can have a subclinical hypothyroidism where you produce antibodies, you attack your own thyroid with your immune system, but you're not aware because your symptoms are either very mild or not present at all. The resulting effects then are such that you can have low-level problems like infertility, irregular period. You could even have problems with reduced performance, reduced cognitive function, things that are maybe considered brain fog or sleepiness or tiredness, but not enough to call them direct symptoms unless you know to look for them. As a result, we see this correlation then between the age of the woman getting pregnant. We see a correlation between the pre-existence of these kinds of diseases and the ability or inability to have children. As a result, there is growing research into this field, and among other fields, regenerative medicine is one of the fields where we've seen some research growing. And as we look at stem cells within regenerative medicine, we discover that there is certainly some very interesting things to consider, and there's some evidence we ought to consider then for the ongoing research into this field. This does not mean that researchers ought to drop everything and only study this. It also doesn't mean that we should be offering this to everyone straight away without doing more research, but there is a lot of interest. So in this abstract, we see that there is a discussion then of significant progress having been made looking at stem cell therapies and gene therapies for autoimmune diseases. And in particular, we know that is because stem cell therapies in particular are very, very good at regulating immune activity, or in particular maybe overactivity. They also seem to have a lot of advantages in that stem cells are easily available. You have them rich in the bone marrow, they're richly found in adipose or fatty tissue, and a fat extraction or liposuction, if you will, even a very small one, is a very simple, easy process, and it can have very, very good results. This means then that there is a fraction in your body which is self-renewing. You can take them out. It's one of these renewable resources. It has a multi-potent, there's many options, it can do different things. They're a type of stem cell that are actually very safe to give to you, especially if they're your own stem cells, because they're unlikely to cause any trouble. If anything, they will only cause, I can't say they will only cause beneficial effects, but it's extremely unlikely they will cause harmful side effects, given that they're your cells and you won't reject them as they are from your own body. And as we look then at the idea of infertility, we're going to find that within infertility in general, there is a few things which are very important to consider. In order to establish fertility, to establish and maintain pregnancy, the body must make the right hormones at the right time in the right dose. So the immune system has to work, and we'll come up here a little bit bigger so I can discuss this in more detail. So in order for a woman to get pregnant, obviously, it has to be a man, it has to be a woman. We need a seed and an egg, and they have to get together. Beyond that, the woman's immune system must not attack that egg or that sperm as they're trying to get together. It must not attack the fertilized egg before it implants. And the immune system has to tolerate the presence of the fetus, the baby, as it grows and gestates in the womb. This means that if you have an immune system problem, you might actually have an inhospitable womb where the tissue is not available for implantation, where the egg comes down, it's fertilized, it's ready to go, but it just can't find a place to sit. You might also have problems then with the endocrine system itself. And as we know, for men, the most important hormone is probably testosterone, but for women, the hormones in general are very important, all of them together. And you have to have the right cycle. You have to have the estrogen, progesterone. You want them to come together. You want to have LH and FSH, and you'll have the graphs, which we all know in medical school. We learn about it, probably nurses as well learn a lot about this. So I'll overlay them here just to let you see what I'm talking about. As you can see from the cycle here then, we have menstruation every approximately 28 days, and every 2 weeks after that you're going to have the new egg being released from the ovary. It's ready to go, ovulation happens, and that's the fertile window. If there's something wrong with the endocrine system or the immune system, then these cells may not actually be able to be released on time, or there may be problems with the menstrual cycle in general, where people can have a lack of cycle, or the cycle can be very unpredictable, or of course there can be infertility caused by the fact that perhaps the ovaries don't even produce the egg and let it be released as we would expect. So as we previously mentioned then, thyroid autoimmunity affects this large number of women in reproductive age, so between 5 and 15%, and there's a growing body of evidence that this may actually directly influence reproductive health, independently of the thyroid hormone levels. Now, when we talk about thyroid hormone and thyroid hormone levels, usually we're talking about TSH, T4, and T3. TSH is thyroid stimulating hormone. It comes from the brain, and as the brain tells the body that it needs to do the job to produce more or less T4, T3, that is sent from the brain. Then the chemical signals are sent in the blood to the thyroid system, and the thyroid gland will then produce the hormones necessary into the blood again to go and give the tissues their required amounts in order to function. The working hypothesis then is that these thyroid antibodies, if you have autoantibodies where your body is actually attacking the thyroid, that they may cause the immune system to attack other structures, including the follicle, the genesis of the egg, the fertilization process, or the implantation. And even after implantation, there's a certain growing body of evidence which suggests that embryos and babies can be affected. And this may lead to miscarriage, it may lead to problems just with the baby's development, or even with the child's development later in life. As a result, there's been a lot of research into different treatment options. There are different treatment modalities considered, but one of the summaries in this paper then is that stem cells seem to be a, by and in large, safe alternative to try. However, more research is needed, and this is really the, I suppose, end point of this video, is to say that we know that stem cell has been tried now for a lot of different diseases: MS, Alzheimer's, dementia, various neurological diseases like ALS. We even have seen it used for Crohn's disease and irritable bowel syndrome, many different diseases, kidney problems, cardiac problems. And in general, whether the result achieved is the result desired, there are very few reported severe adverse effects, very few reported side effects, because these treatments really ultimately come from your body and they go to your body. We've talked about this in a previous video, but if we take the stem cells, we prepare them and we inject them into the vein, what is it that stops the stem cell going somewhere else in your body than where we desire? And the real answer here is very little. The stem cell can go to where it feels most chemotactically attracted. That means that the cell will then go around the body to the area it thinks needs the most help, not necessarily the area your doctor or treatment provider thinks needs the most help. This is something that I think we'll see more and more research into as time goes on. Perhaps we'll see gene therapies that can result in directed, targeted stem cell therapy. Or perhaps we'll find that just people need serial stem cell therapies in order to give them the results over time, where the body starts to heal in general, and maybe even we could get some anti-senescent effects, so we could get people being younger and healthier in general. It's hard to know, but certainly I think I've learned something from this paper. I hope you have too, and I will see you again in the next video. Have a great day.